This month marks 5 years since World Health officials designated COVID-19 a global pandemic. Many of us got COVID-19 at some point, but likely felt better after a few days or weeks.
But for millions of Americans, that's not the case. Some have felt the effects of the disease for years with no relief in sight. New at 6, Marta Berglund sat down with a long COVID patient and her doctor.
With an interview like this, is this going to cause you to crash?
Definitely, yes.
Rachel Beale warned us from the start. Our 30-minute conversation would exhaust her for the rest of the day.
When this is over, I'm gonna most likely lay down on the couch and I'll be done for at least a few hours. Hopefully this evening I'll be able to, move around a little bit.
And yet the Southampton County mom of 3 insisted the crash, as long COVID sufferers call it, is worth it.
Nobody's speaking up for us. I don't want anybody to have to go through what I've gone through.
Beale first tested positive for COVID-19 more than 4 years ago, on March 17, 2021. Her symptoms, a high fever and intense muscle aches. Days turned into weeks with no relief. After 3 months, Beale's doctor diagnosed her with long COVID, 6 months homesick from work, and she was forced to officially step away.
I had hated that I was sick and hated that I couldn't do all the things I wanted to do. If I sat here today and just started listing all the things that have happened, I would be in tears. It's very depressing. It's life-altering.
Today, some of Beale's initial symptoms have dissipated, only to be replaced with others. She sleeps with an oxygen mask, uses an inhaler, and takes heart medication. Every day battling asthma, brain fog, joint pain, and intense fatigue.
But if I'm in a crash where, I've done too much and I've crashed, I sleep and rest the entire day. I don't move from the couch or the bed.
She could drive me up to school and back and she would get exhausted. I really miss how active she used to be.
Beale's oldest son, 17-year-old Landon, reflects on watching his mom change over the years.
She can't really do much anymore. And so I really have to take care of her now. Like, I run a lot of errands and stuff for her. It's really sad for me because she's our mother.
As a mom, it just made me feel like I was a burden more than anything.
Her first trip to Centera's long COVID clinic felt different. A listening ear after years of doubt from doctors.
And it was very validating to have a doctor that knew 100% what I was talking about. And I didn't have to prove that I was sick or prove that I had these symptoms.
The long COVID symptoms are very tricky.
Beale recounted her experience with the disease to Dr. Shen Chow for more than an hour during her first appointment. Dr. Chow says the list of symptoms long COVID patients experience is lengthy, but many suffer from intense fatigue and brain fog, just like Beale.
They would tell us that they would walk into a room and then they would forget what they were going to into that room for. And they would also sometimes have trouble recalling words.
Centera's long COVID clinic opened in October of 2020, initially with the intention of treating lung scarring in COVID-19 patients. But Dr. Chow says the medical team had no idea how much there was to learn.
It's a little bit of both, frustration sometimes, but also a lot of intrigue. Because we are seeing a brand new disease process, we may not have the information to fix this problem very quickly.
After 4 years of feeling sick, Beale rarely lets herself think about the future. But when she does, she tries to stay optimistic.
I don't like to think too much about having long COVID because it's overwhelming for me. I want a cure. I'm waiting for the cure.
Even after half a decade of searching, Dr. Chow still believes a solution is out there for Beale and the millions like her.
I think one day we will have something. I don't know when that day will be, and I don't know what that will be, but if I didn't think that we could fix this, then I wouldn't be doing this.
For 13 News Now, I'm Marta Berglund.
And Rachel Beale has advocated extensively for long COVID patients, including testifying at a Senate committee hearing. You can find our full interview with her on our streaming app, 13 News Now Plus. Just download it to your TV to watch for free.